Hello dear students, today we will be learning about the mandibular anatomical landmarks. So you can see this is a mandibular cast showing the landmarks in different colors. So we will see first the names of all the different anatomical landmarks. So this is a band, you can see a brown colored band in the anterior region. This is known as labial frenum. This light green painted color depression, that is labial vestibule. One more band, that is buccal frenum. Again this is a buccal vestibule. This is retromolar pad. These are the buccal shelf area. This whole part is the residual alveolar ridge. This is the entire part of the residual alveolar ridge. This one more that is addition here, that is not present in maxillary and landmark, that is lingual frenum present on a lingual side, and this is the alveolingual sulcus. It is, we have given a 3 different colors so that we can differentiate into the entire part, middle region and the posterior region of alveolingual sulcus. Okay, and here our tongue rest. Tongue is not an anatomical landmark. Okay, so we can relate certain anatomical landmark with the jaw, that is mandible. You can see this is the mandible. You can see this is extraction socket, and after the resorption it will form very good residual ridge. Here is the buccal shelf area and retromolar pads will rest here. This is, here you will see the lingual frenum towards the tongue side. These are the mental foramen. It is not present in the cast. Okay, this is the, but we will tell you about this structure during the discussion. This is mental foramen. This is a genial tubercle present on the lingual side. So let us start with the anatomical landmarks. So as we have seen in the maxillary anatomical landmarks, it is categorized again into 3 limiting areas, stress bearing areas and the stress relief areas. So what are they? Now first we will see the limiting areas. Limiting areas means here our denture border will end. It will, the extension of the denture border will end up to this limiting area. So which are they? So this is the labial frenum, band of fibrous band covered by the mucous membrane present in the midline towards the lip, that is known as labial frenum. Now one more frenum you can see, that is the buccal frenum present towards the cheek side, that is buccal frenum. Again a fibrous band covered by the mucous membrane. Then one depression that is present towards the lip between the labial frenum and buccal frenum, known as labial vestibule. Then one more depression between the buccal frenum and the retromolar pads, known as present towards the cheek area, known as buccal vestibule. Now in the center towards the tongue side, you can see one more band. This is known as lingual frenum, and it is very active frenum, and it is present towards the base of the tongue, and you will have to record it very nicely. This is very active band of tissue. And the last or you can see on the lingual side, one more limiting structure, the alveolingual sulcus, which is divided into the anterior part, middle part and the posterior region. This give various muscle attachment, and while recording the impression you will have to record this alveolingual sulcus very nicely. If your denture border extend beyond this alveolingual sulcus, so your denture will dislodge whenever the patient do tongue movement. So you will have to record the alveolingual sulcus very correctly by telling the patient to do certain tongue movements, like touching of the tip of the tongue to the lip, upper lip, then touching the right cheek, left cheek, like this way you will have to record this alveolingual sulcus. Last limiting structure is our retromolar pad, which is a triangular soft pad of tissue at the posteriormost end of the mandibular residual ridge. Okay, so these are the all are the limiting areas. What are they? Labial frenum, labial vestibule, buccal frenum, buccal vestibule, retromolar pad, alveolingual sulcus and the lingual frenum. Now second is our stress bearing areas. Here we can apply stress. So the primary stress bearing area are the buccal shelf area, which are, it is right angle to the masticatory load, making it appropriate for the primary supporting area, and it is made up of cortical bone, and it is firmly attached to the mucosa with the muscle fibers. So this is considered as the primary stress bearing areas. Now these retromolar pads and the slopes, buccal and the lingual slopes of the residual alveolar ridge can also be considered as the stress bearing areas, but first and foremost the primary stress bearing area is your buccal shelf area. Now the relief areas. The relief areas are where we cannot apply much pressure because of having the delicate structures. So the entire part of the residual, sometimes it is very knife edge, means it is because of the resorption it becomes very resorbed, it becomes like a knife. So you will have to give relief to such area. So that is crest, if it is a knife shape crest of residual alveolar ridge, you will have to give relief. Then the torus mandibularis, as we have seen torus palatinus in maxilla, so it was present in the center of the palate. So the torus mandibularis, they are present on the lingual side towards the premolar region. So again, if it is bigger, then you will have to excise it, and if it is small, then you will have to give relief to such areas because they are covered by very thin mucosa. Next is a mental foramen. You cannot see mental foramen in this cast. So we can see this in the mandible. You can see this mental foramen present on both the side. They are present in between the first and second premolar root apices. So what happens? This is the adult jaw. So here you can see the mental foramen is just very much below towards the below the residual alveolar ridge. But as the age advances and as this ridge get resorbed, so this mental foramen it come upwards towards the ridge area. So if our denture border is extending there, so it will impinge on the mental foramen, and from mental foramen the mental nerve get passes, which supplies to the various part of the mandible. It supplies to the lower lip also. So if your denture border is extending here, it will impinge the mental nerve and it will give paresthesia to the lower lip. So you will have to relieve this. After this, one more structure that is known as genial tubercle, which is present on the in the midline in the lingual border of the mandible. Again, because of the resorption, it will come upward, and if your denture border is extending here, it will again impinge there and it will give discomfort to the patient. So you will have to give relief to genial tubercle also. So these are the different anatomical landmarks that we have seen in mandibular arch also. That is, relief areas are the crest of residual alveolar ridge if it is knife edge, then your torus mandibularis if it is present, and of course the mental foramen and the genial tubercle. So this is all about the anatomical landmarks of mandibular arch. Thank you.